Hello, everyone. Good afternoon. Happy Thursday. It's really nice to see you all. Thank you for joining us. My name is Alice Nelsner, and I'm the CEO of the San Bernardino County Medical Society. We are super excited about today's presentation because we have a true star with us as our presenter, a longtime leader and member of the California Medical Association, San Bernardino County Medical Society, and Riverside County Medical Association, for whom he has served as president and in a leadership capacity for a very long time. We are co-presenting this session with our sister organization, Riverside County Medical Association, as well as IEHP, Inland Empire Health Plan. So today's presentation is entitled Lifestyle Medicine for Health Longevity, Nutrition, Sleep, Stress, and More. And this is number 11 in our clinical education webinar series. It's amazing. This has been going on now for a year, and we've had such success with this. We're going to have one more session coming up. We'll have a couple month break, and then in April, we'll have that. But today we want to focus on the excitement and about learning what we're going to learn from our presenter here. So with that, I'm going to go ahead and introduce someone I am very, very excited to be in his presence. Joseph E. Scherger, MD, MPH, who is owner and medical director for Restore Health Disease Reversal. And I would like to actually read you his full introduction right now. Dr. Scherger is a family medicine at Eisenhower Health in La Quinta, California. He's also a core faculty member with the Eisenhower Health Family Medicine Residency Program. Dr. Scherger is a clinical professor of family medicine at the Keck School of Medicine at the University of Southern California, and he's a leader in transforming office practice with a special interest in nutrition and using lifestyle change to reverse disease. He's the author of 2 books, 40 Years in Family Medicine from 2014, and Lean and Fit, A Doctor's Journey to Healthy Nutrition and Greater Wellness. 3rd edition was published in 2019. Originally from Delphos, Ohio, Dr. Scherger graduated from the University of Dayton in 1971, summa cum laude. He graduated from the UCLA School of Medicine in 1975 and was elected to Alpha Omega Alpha. He completed a family medicine residency and master's in public health at the University of Washington in 1978. Dr. Scherger has received numerous awards, including being recognized as a top doc in San Diego for 6 consecutive years, 2004 to 2009. He was voted outstanding clinical instructor at the University of California, Davis School of Medicine in 1984, 1989, and 1990. In 2019, Dr. Scherger was elected to the Bishop Society of the Society of Teachers of Family Medicine. Dr. Scherger currently serves on the editorial board of Medical Economics and was an assistant editor of Family Medicine from 2010 to 2017. He was the men's health expert and a consultant for Revolution Health, 2006 to 2009, and he has covered California for EDOC America since 2003. He was editor-in-chief of Hippocrates, published by the Massachusetts Medical Society from 1999 to 2001, and he was the first medical editor of Family Practice Management. And he's also a wonderful colleague, partner, leader, and mentor for all of us. So Dr. Scherger, we turn it over to you, and we can hardly wait to hear from you.
Oh, thank you, Allison. I'm honored to be here, and I'm honored to share my excitement with fellow physicians. I've done standard traditional primary care all of my career, more than 50 years now, and but about 15 years ago, I was always interested in nutrition and the science of nutrition and being healthy. So I began to read and realize that the biology of what makes up good nutrition had changed from what I had learned. We were all indoctrinated into the low-fat diet, the recommendations, and the new recommendations realizing that healthy fats are actually some of our most important nutrition, and that the overweight and obesity epidemic was largely driven by the fact that we demonized fat and we gave sugar and carbs a free pass, and that's got a long and sordid history. But we now know that of the three macronutrients, protein, fat, and carbohydrates, the only one that biologically causes fat storage is carbohydrates. There's a pathway between carbohydrates, insulin, which we know about it in type 1 diabetes, but for most of us, insulin is a fat storage hormone, and it blocks our ability to burn fat for energy. So we're in a situation where we have this very unhealthy in population with an epidemic of overweight, obesity, insulin resistance, and all of the type 2 diabetes and neurologic problems that come from that. So I switched, and I basically, in the first 2 years of doing this lifestyle medicine work, I took more weight off my patients than I had in the 40 years prior, getting them there. And I did it myself and lost 30 pounds. There's a magic that happens when you reduce your carbohydrates. You get below your carbohydrate threshold, which means you're allowing yourself to burn some fat for energy every day. You get below that, all of a sudden you're not hungry anymore. That 4 o'clock hunger that I used to always get and buy a muffin on the way home, never again. I have a high protein, high fat breakfast that is in the back of my book. If you get the Lean and Fit book, it's on Amazon. I actually have a new book called Restore Health, Disease Reversal that also has those same resources in the back of it. Which covers the 52 healthiest foods you can eat, which are all low carbohydrate. They're all real foods, if you will. And we know in the world of lifestyle medicine, and I also studied the term functional medicine, which means you go to the root cause of disease. 80% of chronic disease is due to an unhealthy diet and lifestyle. So if you get yourself familiar with the good biology of lifestyle medicine, you can do so much good of restoring people's health. We used to kind of manage people with type 2 diabetes. Now I reverse people with type 2 diabetes routinely. I've been doing that for more than a decade. You can help maximize chances for things like cancer remission. You can increase people's longevity. Your patients are so grateful when they become healthy again. Every day I have patients coming in who've lost 30, 40, 50, 60 pounds. And, women are so excited to have their waistline back and their figure back. They tease me about the cost of all their new clothes that they have. But this is so reinforcing and so rewarding that for a person like me in my mid-70s, I'm delighted to go to work because I just have so many grateful patients that I see. So I would just encourage you, and I'm happy to help any of you. We can be connected online about learning some of these tools. After reading for a couple of years in this area, you begin to get very familiar with it. And reading my books, Lean and Fit and Restore Health, Disease Reversal, will give you a really good introduction. I don't claim to be an original. I just synthesize the knowledge from some of the smartest people I know that aren't tainted by industry things. There's a family physician named Mark Hyman, who was the head of functional medicine at the Cleveland Clinic and is one of the real leaders in this field. He has just published a revised book on his food fix, how to fix our nation's food system. And he goes into detail about the difficulties of getting our food system right. And for a healthy lifestyle, you got to start with nutrition because that's 80% of the equation. You can't exercise or sleep your way out of a bad diet. You've got to get your diet, what I call purified, eating real food. And it's kind of an exciting time for that because while I disagree completely with Kennedy's ideas about vaccinations, and it's too bad that he has smeared his name that way, he is an incredibly healthy person in his 70s because he just eats real food and it's low carbohydrate. And yesterday, in front of Congress, there was a doctor, a woman named Casey Means, who got disillusioned by trying to become a surgeon because she was just doing reactive care to people with self-destructive lifestyles. That she switched her career into lifestyle medicine, has a wonderful book called Good Energy, and she might even become our next Surgeon General. She and Kennedy are pretty closely together, which their Make America Healthy Again initiative through eating real food is actually very exciting. So, whatever else you're saying, it's a shame that he has got these crazy theories about vaccination. So, to summarize, eat the healthy foods of nature, eat real food. Avoid sugar and simple carbohydrates. Those are the things that create fat storage and inflammation to a high degree. Avoid overly processed foods. Foods that are real, like eggs and apples and fruit and vegetables and meat and fish. When you buy those at the market, there is no food label. It's only one thing. It's the food that you're buying. If you see a food label with a bunch of ingredients, some of which you can't pronounce, you know that that's an ultra-processed food. And there's a bit of a debate going on which is worse, the sugar or the ultra-processed foods. And the reality is that both of them. And so the key is that you want to do that. You also, you want to get plenty of good, healthy protein in your diet. Nuts and seeds and meat, fish, and eggs are rich sources. And then you want to give your body time to restore and repair. Now, the science around the necessary fasting time to restore and repair your body, Dr. Sachin Panda at the Salk Institute in San Diego is the world's expert on that, has showed that the body needs 12 hours of not eating. The other neurobiologist Dale Bredesen has showed that you don't eat 3 hours before you go to bed to sleep well, and you get more than 12 hours of only water, coffee, or tea. Stay well hydrated. You can stimulate your brain with a cup of coffee or tea, but don't get calories during that time. Your body needs it to restore and repair. Plus, if you have excess body fat that you'd like to burn off, you will become ketogenic, that is, you're burning body fat for energy at a high degree. And a formula for getting people to lose weight is to eat 2 meals a day in an 8-hour period that are rich in healthy protein and fat, and give yourself some hours of the day to be a fat burner, along with staying hydrated. The formula of a low-fat diet with what I like to call time-restricted eating, the word intermittent fasting is not always a positive word, but time-restricted eating is another way to say the same thing. And be careful about journalism and the headlines. Medscape just this morning had a headline: has the intermittent fasting craze over? Which is a crazy comment. But studies show that intermittent fasting alone doesn't result in weight loss. And the reason why is because if you eat the standard American diet during your 8-hour eating window, that is a lot of carbs, you're not going to lose any weight. So it doesn't work. It only works with a combination of a low carbohydrate diet and time-restricted eating or intermittent fasting. And Dr. Panda has a couple books on that. There's numerous books that support that approach. That's our biology. Now, the food industry doesn't like these kind of things. I mean, if people only eat 2 meals a day, they've cut their food consumption down by 1/3. And if they and the food industry makes more money on sugar, carbs, and processed foods than any other thing, and they're designed to be addicting. I mean, the people who really work in this area say that I'm not in the nutrition business, I'm in the addiction business, and I reduce the addiction. The GLP-1 drugs can be helpful. They're not necessary to do this, but they make it helpful because one, we found out that these drugs really curb your addiction, especially to sugar. So they make it easier to accomplish this. But I have people who've lost over 100 pounds just by giving up the breads, the flour foods that are high glycemic, giving up their sweets, including ice cream. They only eat superfood fruits such as berries and avocados and not the other stuff. And alcohol is a big problem. You can't lose weight if you have a couple drinks a day. So, a lot of people say you're taking away all my pleasures, but I'm just trying to give them health. And once that happens, it's self-reinforcing. There's a model named Kate Moss that has famous for the expression, nothing tastes as good as feeling thin. So those are the principles. The other comment I'll make about nutrition is that a lot of our leaky gut and autoimmune disease are driven by some of the proteins that are in foods that we really are not designed to eat. Our bodies are hunter-gatherer bodies, and the wheat, the seeds of grasses that create flour from wheat has a protein called gluten. It's actually a complex of proteins that can be very inflammatory. So if you want to reverse people's their acid reflux and irritable bowel syndrome, you need to get them also on an anti-inflammatory diet, which is off of the gluten and the breads. And you got to really reduce the casein A protein that's in cow's milk, and make sure they're not having any seed oil exposure. They're only getting olive oil and avocado oil and natural tree oils. So it's not rocket science, but this is kind of the formula for healthy nutrition, and 80% of what lifestyle medicine is about. The next one is good physical activity. And I'm now a geriatrician, being out here in Indian Wells and Rancho Mirage and La Quinta, and I divide my physical activity prescription to be 4 things: movement, strength, balance, and stretching. And seniors should do all 4 of those every day. So 30 minutes of a movement exercise, the most common, of course, is walking, but it can be on a bicycle, or it can be swimming, or something that gets their heart rate up at least 50% above their normal. It depends on their age and their heart health. That's a safe amount of increase. I had a patient in yesterday who just turned 80, and she was worried that she gets on the treadmill, and she gets her heart rate up above 140. And I say, that may be risky for you, because I've had a lot of my seniors give themselves into atrial fibrillation by stressing their heart by too high of a heart rate. But you get a lot of health benefits if you get your heart rate 50% higher than normal. So if your normal heart rate is 60, get it up to 90, and that's a adequate workout. The strength, you have an upper body, a core, and a lower body. Every trainer can give a person I got a nice clipboard of 16 different things I do for strength training that covers my upper body, my core, and my lower body. And I do those regularly. The ideal is 3 days a week of strength training. Balance becomes critical for seniors. And, the gold standard of balance is to be able to stand on one foot for 20 seconds. Most seniors can't do that in the beginning, and they can work their way things. One of the really useful things is if you just Google and you hit Google videos, strength training for seniors. Some very good physical therapists have their 15 to 20-minute videos on how to do it and what to do for strength, for balance, and even stretching. So there's some wonderful videos people can follow that have followed in this tradition of the old Jane Fonda workout, who was the first member of the Video Hall of Fame for what she did way back. For many of us can remember those because we're old enough. So those are the things you want to do. Stretching is usually early in the morning. There's some wonderful therapeutic stretching that comes from yoga, Pilates, Tai Chi, and other similar activities. Sleep is another pillar of good health. And so you want to have 7 to 8 hours of sleep, and you want to have it be good natural sleep, not medicated by Ambien or other prescription drugs, if at all possible. So your sleep routine is, lights out. I wear blue blocking glasses in the evening because that blue light from either television or your computer or your devices will interfere with your melatonin secretion, which is the sleep hormone. Only water 3 hours before bed. Breathing meditation can be very helpful. Realize when you sleep, you got to put your life in the closet like your clothes. I mean, put it aside and just relax. And the four square breathing method is a simple way of meditation, and that's a slow, deep breath in over about 5 seconds. You hold your breath for about 5 seconds, and then you exhale over about 5 seconds, and then you pause before the next breath. It doesn't have to be 5 seconds. That's hard for a lot of seniors to do. But it's the holding the breath that makes you concentrated on your slow, deep breathing. And most people can't do that 10 times and still be awake. You just try it, and pretty soon, you've counted up to 4 or 5 of those, and that's all you can remember doing. So have a good sleep routine. Our pineal glands calcify when we're older, so we don't get as much natural melatonin. So melatonin supplements are good in the evening. You want to balance that correctly. And there's 2 products that I really like because they have not just melatonin, time release melatonin, but they have amino acids that promote sleep and other ingredients. I used to regularly use Sleep 3 by Nature's Bounty. You can buy that Costco, anywhere else. The new one, which I like a lot better, is called Relaxium, and it's marketed by all kinds of people, Bill Riley and Dan Marino, and you name it. But it's not terribly expensive. It's 2 capsules, but it has an ingredient list which is really quite remarkable. There's 5 milligrams of time-release melatonin. It has ashwagandha, which is a great supplement to calm the brain. It has L-tryptophan, the amino acid that's in turkey and warm milk that people have used to enhance sleep. It has GABA aminobutyric acid, which is a relaxing type of compound, valerian root. It has a real, just look up the ingredients of Relaxium, Relaxium, and you'll be impressed. And that's what I now use, and I don't usually need any additional melatonin beyond that, and find myself sleeping very well 30 minutes before I go to sleep. You have to tell patients who are used to Ambien that these are not knockout pills, but those knockout pills are going to knock out your cognitive function pretty soon if you stay on them. So you really want to move to a much healthier formula for your getting good night's sleep. But you want to make sure the room is cool, like down to usually 68 degrees. You have a pillow that you love, a mattress that's right for you. I like a medium firm mattress. Some like them different, harder. And so sleep is another pillar of good health. And the other one of the big 4 is stress. Chronic stress, which gives you chronic cortisol injection, will rob you of your ability to relax. So stress management is very important. Keep calm and carry on, as the British said while they learned to sleep during the bombing of London. Uh, there's a cardiologist who had a heart attack in his 40s and was in the coronary care unit in Wyoming. He was on a vacation. As he was sitting there, he realized that he needed to reduce his stress in his life. He's been long past, but he was really a pioneer in stress management, and he came up with three important rules. The first rule we all know is called don't sweat the small stuff. His second rule is basically everything is small stuff. And his final rule is if you can't fight and you can't flee, then just flow. The whole concept of flowing through stress is a very, very important skill. And people who've been type A and chronic stress most of their life can really learn to flow. If they do learn to flow and keep calm and carry on and not be a hot reactor, which he called people who got mad at too easily, if you can overcome those personality traits, you'll have a longer and happier life. The final two in the formula is number one, be social. We are social creatures. We have tribes, we have people we're connected to. We're not supposed to be an island. And so your family and your friends, your relationships are critical to your overall health. It's been shown that they're critical to your survival from cancer, for example. And so cultivate real friendships, nurture those, do what feels right, avoid toxic people in your life as the best you can. So the social nature is important. And then finally, have meaning and purpose in your life. That's kind of the spiritual side of healthy lifestyle. What are you living for? It doesn't have to be a church community, but it could be. A lot of times church communities provide both the social and the meaning and purpose. But have something that you're living for. And if you have grandchildren and things that you're milestones that you're looking for coming up, that can give you a real sense of meaning and purpose. So those are important too. So those are the big six ingredients of a healthy lifestyle. And I go over that with patients. I now have my new patient visits are always an hour, and I don't do the old traditional review of systems. I make sure I cover and aware of whether they're healthy, but I review all these six elements about them and their life, and usually there's a few things to work on, and we work on those things, and they're eternally grateful to you. And I follow them up usually with 30-minute visits. I keep my panel size reasonable. It's a relationship-centered style of care. And in primary care, there's nothing more rewarding. I mean, I live in a golf course community. I'm 75, and every day I drive out of there and think, would I rather play golf or go see my patients? And the answer is always go see my patients, because I've cared for them for a long time, and it's using these principles, it's very, very rewarding. So I've spoke for about a half hour. I'd love to take some comments and questions.
Wow, Dr. Scherger, you are just such an amazing presenter. I'd forgotten how fun it is to listen to you. Really, every single thing you say is substantive and really offers some great guidance. So thank you for that. I'm looking to see if we have any questions in our chat.
I have a comment.
Yes, please. Hi, Dr. Lane.
Hi, Allison. Yeah, Dr. Sugar, I'm a doctor. I've just retired, a doctor with USA Wrestling, and for about 25, 30 years. And as you probably know, wrestlers starve and dehydrate to make weight forever. I did when I went to UCLA, and after a year of starving to wrestle, I stopped my wrestling scholarship and started doing research, and that led eventually to medical school. So, but after the Beijing Olympics, we did terrible. Our national team coach came back and said, enough of this starvation. And he hired one of the world's best nutritionists um, um, from Canada, Jennifer Gibson. And she came down and she started applying her simple principles to our wrestling team, and they all started losing about 2 to 4 pounds a week. And then when they got to their wrestling weight, they would start adding other healthy foods. And she said, and so I was putting on a conference at the World Cup in LA, and we had 10 teams from across the world. And I was putting on a sports medicine conference. She was my keynote speaker. I'm almost done. And she said, I said, Jenny, what do I need to know about sports nutrition? And she leaned back and said, well, Dr. Lane, number one, half your plate needs to be protein. That's wrestling. And the other, that's more than we need. And the other half is all fruits and vegetables. You eliminate liquid calories. For our wrestling coaches, that was beer. For me, that was milk. But you eliminate drinking your calories. You eat nothing out of a bag or a box. And you hold off on rice and beans until you hit your weight. Then you start adding back the beans and the rice to maintain your weight. And I said, Jenny, are you kidding me? It's so simple. She leaned forward and said, Dr. Lane, it has to be simple. I'm dealing with wrestlers.
Well, Dr. Lane, those are wise comments, and I love it. Yeah, this is not rocket science. This is
No,
common sense. But you've got a food industry out there that has bought off the American Diabetes Association. They've bought off the American Heart Association. The American College of Cardiology is kind of in there, and they do things that sabotage the common sense of healthy nutrition because if you follow what you're describing, and the population did that, it would have a tremendous impact on our processed food industry. So, realize and watch out for the headlines that are out there. Like just this morning, it had this thing that intermittent fasting doesn't work. Maybe the fad is over, which is an absurd statement. There's two sides to the coin, low carb and intermittent fasting. Intermittent fasting is worthless. Even the GLP drugs are worthless if the person is still eating above their carbohydrate threshold. Atkins knew that the carb threshold was 50 grams a day for men. So if men eat more than 50 grams of carbs, they're not going to lose weight and they'll continue to gain weight. But unfortunately for women, it's as low as 25 or 30 grams. So women struggle to lose weight through a low carb diet because they have a threshold to become a fat burner that's much, much lower. Now, interestingly enough, we don't need carbohydrates. There are no required carbohydrates. The Eskimos and the Maasai and other tribes in Africa who have a zero carb diet use gluconeogenesis to create their blood sugar, and it's always normal. But I don't say avoid all carbohydrates because the carbohydrates that are in healthy vegetables and things are important. But it's got to be the combination of low carb and the time restricted eating. The other thing you triggered for me that I want to mention is I do a body composition on every one of my patients. I own an in-body using the Tanita technology developed in Japan. So every time I see a patient, I take the normal vital signs, but I consider my vital signs their body composition, which is able to go through the body instantly and tell me how much water is there, how much fat is there, and how much muscle is there. And then it has a score on your skeletal muscle mass and your body fat mass. And I have a lot of people who are TOFIs or NOFIs, whichever one you like. It means thin outside and fat inside, or normal outside and fat inside. And you find out they're way behind on muscle and they have excess visceral fat, even though their weight is okay. So, my mission in lifestyle medicine is to optimize as much as I can a person's body composition. And when they see the numbers, that's really motivation to them to do more strength training and to do more fat burning in their lifestyle. And when they get their body composition right, they are uber healthy, if you want to say it.
Right. That's a great discussion there. I
I
love
love
hearing
seeing
that.
Dolores smile because Dolores has undergone a transformation. When I saw her at the reception we had in Palm Springs, I was so happy to see how healthy she looks. And you've always, well, you made a transformation too, Allison. I remember when I first met you, you're different than you are now.
Yeah, I was a chunky monkey when you met me, and I've about 4 years ago I got on the GLP thing, but yeah, I eat a lot healthier too. You're right, but yeah, Dolores now Dolores and I love taking pictures together. She's excited.
Just need to firm up. That's the biggest problem.
Yeah, that's the issue, Dr. Scherger, that Dolores and I share, commiserate on that. We're not 21 anymore, so
Yeah.
we're trying to firm up.
So, Dr.
Yeah.
Sugar, one other policy that Jennifer Gibson suggested is when you go into the grocery store, you start in the fruit and vegetable section, and then you go around to the meat section. And unless you're getting dog or cat food, you never go into the aisles.
Shop the periphery of the grocery store and stay
Yes.
away from the aisles.
Yeah.
That's a very, very good general rule of thumb. We do that all the time.
Yeah.
Yeah. Do you have any other comments, Dolores? Did you want to say anything to your member, your RC member?
No. I think
Okay.
it's great information, and so much of it is common sense. It's just putting that common sense into practical play every single day. So thank you for that information. And I think the aids that are available, they're very helpful, I think, in squashing some of the food noise and all of that helps you make better choices.
We have 14 people on the call. Does anyone else want to say? I think there's someone in the chat box. Let me take a look at that.
Get something else in chat.
Yeah, I think that was somebody read.ai meeting notes. Okay.
Yeah, those are our meeting notes. Yeah, and you guys, well, we've got Dr. Scherger on here. Let's ask him our burning questions. Does anyone have any comments? This is the time. There's one, Janice. What was the name of the supplement? Super 3 and something else you mentioned. And
one is called, Sleep 3. And the company is a quality supplement company named Nature's Bounty. It has a time release melatonin of 10 milligrams, but the other ingredients really augment that. And the other one is Relaxium. It's an IUM after the word relax. That's now what I currently use, Relaxium. And when you get the bottle, it'll say Relaxium Sleep in big words. And it's got a wonderful blend of ingredients that I enjoy a lot more. So it's my ticket to a good, calm night's sleep.
What about her part two of her question? From your perspective, what age do you consider being a senior? When would you classify that?
That's fun. I have fun with my patients. There's three phases of being a senior. There's the young old, the old, and the old. And the young, and they aren't hard fast, but the young old are obviously the people that get senior benefits, even though they don't look or behave like a senior at 60, 65, and that can go into your 70s. But as a guy who's 75 myself, I mean, in my 60s, I ran 15 ultra marathons and stuff. Now I have spinal stenosis with weakness of my nerves and a foot drop on the left. So those days are over. So now I'm old. And I've really realized my balance is not what it used to be. So I'm definitely old, but people somewhere in their 80s kind of become old, and you got to make adjustments. One of my patients who lived beyond age 85, but he worked for the Metropolitan Life Insurance Company where they had all those tables about who they'd sell life insurance to. And he said, once you hit 85, all bets are off. And I'm an observer to people's aging and end of life. I even do hospice work, believe it or not. I do hospice calls today. But people age more between 80 and 85 in general than they did the whole decade of their 70s. Out here in the desert, the 70s is really middle age. Everything's reset 20 years. I mean, the amount of tennis and pickleball and golf that people are playing here in their 70s. But then sometime in their 80s, they're not hitting the ball as far. They're not as good. They become 9-holers instead of 18 holes. And then in general, everybody's different, but in general, over 85 bets are off. And between 85 and 90, there's a lot of aging that can take place. Now, there's things you can do to counter some of that. And certainly the key is to keep your brain healthy as long as your body is going to be here. So I do a lot of work in cognitive function, but in cognitive decline, the big three is have a healthy blood sugar. And that doesn't mean a sugar up to 105 that's fasting. You want your fasting sugar to be below 100. When I was in medical school, the normal fasting blood sugar was 60 to 90. And that's what a healthy fasting blood sugar should be. But because, people have allowed it to go up because of the diet, we now call normal up to 105. Normal doesn't mean healthy. Every lab result will have a healthy range and a normal range. And you pay attention to that, because I focus on the healthy range instead of the lab, so-called normal range. But yeah, but I do admit that, we all do get old. I read a book on longevity by these immortalists. I go to this meeting every year called Revolution Against Aging and Death. And I'm actually a medical director of a company that rejuvenates the immune system called Intervene Immune. So, and there's some interesting science around why we age, but some of these people think that they're going to figure it out. And, Ray Kurzweil and a few other, Peter Diamandis, they think that the first person to live to 150 has already been born, and they're going to figure this out. I don't buy into that, but there are ways. I have my stem cells harvested from my adipose tissue. I get a infusion of my own stem cells every 4 months now. I used to do it once a year, and then I got a little older and I realized I better do it twice a year. And now I do it every 4 months. So that's part of my rejuvenation biology. Is it going to work for me? I don't know. Time will tell. But I certainly don't feel my age. And nobody kind of says that. But there are some rejuvenation biology things you can do. But if you don't follow a healthy diet and lifestyle, it's all wasted effort. I've got one patient who's doing a lot of stuff, but he's 60 pounds overweight, and he refuses to do the hard work of burning off that excess fat. And so all the rest of the stuff is probably going to go for naught.
Yeah, it's got to be a package effort, right? Dr. Scherger, Dr. Frausto, you remember Dr. Frausto? She's got she's got a couple of questions here. First, a comment. She wanted to comment that physicians really do need more education on how food is medicine. But then she also said, which I don't think we did discuss, eating until you're just 80% full. What's your perspective on that?
Well, that's harikachaku. That's the Japanese expression for, the blue zones, of which we're trying to be a blue zone out here in the Coachella Valley. But Okinawa, the blue zone, these are the people who, more of the people live above 100 than any others. But the Japanese have this, at every meal, just eat till you're 80% full, and you'll be well nourished. So it is a very good idea. It's all part of it.
Okay. And physicians need more education on how food is medicine. I think that makes a lot of sense, especially ones who maybe haven't been to medical school for a while. It seems like sometimes the younger generations are more aware of that.
I have a big thing in my office here: let food be thy medicine and medicine be thy food, by Hippocrates. And I got to go with a group of doctors to visit the island of Kos in Greece. And it's interesting that Hippocrates, this is 400 or 500 years before Christ, he actually ran a health center. He ran a health hospital that literally used food as medicine in ancient Greece. If you get to the island of Kos, that's a terrific place to visit. And the famous 12th century physician rabbi Maimonides has an expression, any disease that can be treated by diet should not be treated any other way. That's a profound statement because it applies to everybody with type 2 diabetes. You just, the drugs and the other things, just you can reverse type 2 diabetes by, getting on a very low carb diet. And I've got a lot of the science behind me here for people who are leaders in that area. So yeah, a lot of this is really ancient wisdom that needs to be brought into modern medicine.
Well, we're glad that you are continuing to make physicians and patients aware of it. I think if more, like Dr. Fausto points out, if more people would embrace this and really, pay good attention to it, I think our health metrics would improve. I have a really random question for you, and you don't have to answer it, but did you see the reports on social media of RFK and Kid Rock in the gym together?
Did not see that. But
Okay.
he's got quite a body right now for
Yeah,
a
he
guy who's
does.
mid-70s.
Yeah,
Yeah, he's
I
in
mean,
great shape.
yeah, he really is. It's
He
amazing.
lives in California. He's part of Southern California, and I read his book about his drug addiction and alcohol addiction, which was quite profound. He's had quite a varied life, different marriages and things, but he's clearly devoted to being uber healthy right now. It's just too bad he's got, conspiracy ideas about vaccines, and he won't give in to the science. But I hope Casey Means becomes the Surgeon General because she deflected all the vaccine questions, saying that I'm not going to say one word about that. And she's not anti-vax at all, but she is very, very pro-nutrition and healthy nutrition. And so I think that would be a breath of fresh air.
We'll have to look into that. I'm really not familiar with her. That sounds like something we should be aware of and someone we should be aware of. Thank you for that. I have a question on nutrition and longevity. With regard to like you just referenced RFK, having formerly, we know, well documented his drug substance use disorder in the past. What kind of effect does that have on someone long term when they try, they've done everything they possibly can now to turn their life around, to eat healthy, to exercise, or does it just kind of depend on the physiology of each person's body?
Well, it does, but there's an important concept. The body wants to heal.
Okay.
We're evolutionary beings. Homo sapiens goes back 300,000 years, but the hominids, the human species, go back 2.5 million years. And we wouldn't be here if our ancestors could not survive food scarcity, that is famines. If we really went back in our own lineage, 12 generations or whatever, we'd realize that we are a race of survivors. So what I get to see is that the body will heal, and it'll, even heal from the earlier alcoholism and drug. It doesn't have to lapse into permanent damage, and I don't believe there's any information that he's been permanently damaged by his past. The old, we all lived through the smoking cessation era. That's still there, but not where near as common. But people developed irreversible lung disease after about 20 years of smoking, or 20 pack years, which means that if you only smoked for 10 years at no more than a pack a day, you could completely heal your lungs if you quit and abstain. So the body really wants to heal. I see it all the time. I have alcoholics who come in who've reformed. I have one patient who's now in his mid 80s. He's getting close to 90, and all of his friends are gone. But he came to me because his friends said, "Would you please help this guy? He's an alcoholic." And so he came in to see me about 12 to 15 years ago when I was new here. And I looked at him and I said, Roger, you got to quit drinking or you're going to die. I have my come to Jesus meetings with people. I'm very direct in my motivational counseling, but it was the right time for him because he looked at me and he said, okay. And he never had a drink after that. And he's now outliving all of his friends despite, and he had alcoholic, enzyme liver changes, but they all reversed. And so he's really healthy.
That is very inspiring. That's a message of hope.
The body wants to be healthy if we enable it and stop the damage.
Yeah. Well, it's a wonderful, wonderful message. As Dr. Frosto says in the chat, bravo. That's lovely. Well, it's a lovely way to end our presentation, I think, unless anyone else. Dr. Lane.
I have one more comment.
Yeah.
And I'm on the board of directors of the San Bernardino Symphony, and I've developed a talk to take to community organizations to talk about how healthy being in an auditorium and listening to music is for the brain and for your character, making new friends, listening to music. And there's a term called collective effervescence. And that is when you're together, that's like being at a baseball game that you're winning, your team's winning, or being at a symphony. You have collective effervescence and it makes you a happier person.
I love that. Music is a powerful healer. And one of the most profound ways is you've got a patient with Alzheimer's disease and you start playing the music that they loved earlier in their life and it lights them up routinely. They may jump out of the chair and start dancing, to it, that those old memories and the power of music. And dance is actually one of the best aerobic activities a person can do. So that's wonderful.
That's
collective
great.
Effervescence.
I love it.
Collective effervescence. Thank you for that, Dr. Lane. That's great. Well, Dr. Scherger, that was really, really enlightening, and what a lovely way to just kind of inform and educate all of us about how we can continue to be empowered ourselves, I think, to take control of our health. I think you need the right coach, and you're obviously the amazing coach that many people need, but I think it's a great reminder that we have the capability to control a lot of this ourselves, and we should do that. So we thank you. We're honored to have you with us today. We want to remind everyone our next presentation is April 17th, and that's with Dr. Eric Hansen, and that is on effective adult preventive visits and workflows and how we can improve patient outcomes for adults, and that includes seniors. And we also want to let everyone know, for the few that are remaining on the call, a couple of you are physicians. Dr. Simon, hello, see you there.
Lauren and I go back, I remember when she was a kid. She was an adolescent when I met her in sports, physically. And she still now teaches me at the Academy of Family Physician meetings. So Lauren is one of my heroes, and I know the feeling is mutual. I also want to comment, I'm happy to come to anybody's medical staff. My life gets easier on Mother's Day, and that continues through November because the majority of my patients are snowbirds. So, I'd be delighted, Inland Empire, if anybody would like me to come talk to your physician group or any other group, I'd be happy to do that.
That's a really great offer. Maybe we should, Janice and Cetera, when we send out our recap message, let's maybe put that as a little addendum, because that's by Dr. Simon, it's a really nice notation from Dr. Scherger to offer that. So I think we will, for one, be probably taking you up on that, Dr. Scherger. We'd like to have you be more involved.
I'm very affordable because I don't charge for doing these stuff.
Well, I gotta say that's a big plus too from the Medical Society budget. So
I only get money if people throw it at me because it's in their budget. But otherwise, and travel is not a problem in the Inland Empire. I've got my
Yeah, exactly.
self-driving Tesla Model Y that I don't even have to drive anymore. I press the destination and press the button, and it drives
Does
way
it
better than,
really?
oh, it's way better than I drive. I lost my auto insurance because of tickets and dropped the things, but now it's a pleasure. Now, obviously, I'm paying attention the whole time, but
Yeah,
and
yeah.
sure I do. But it's wonderful technology.
I'm glad to know that that works. Sometime we'll have to carpool so I can check out how that works with you.
Love to.
Since we're neighbors here in the desert.
Yeah, that's right. All
Yeah,
right.
yeah.
Well, best
All
wishes to
right.
all of you, and thank you for having me.
Well, thank you. And we'll be sending out the CME code as well for those of you who want to claim your
Yeah,
CME credit. So, Dr. Scherger, thank you. You're a star. And thanks to everyone
yeah.
else. And we'll see you again soon.
I look forward to it. Thank
All
you.
right. We do too. Thank you so much, sir. See you
You're
later.
welcome. Bye-bye.
Okay. Bye.